today I'm going to be doing the IV infusion procedure checkoff. So before I go in my patient's room, I'm going to check the physician's orders and gather all of my equipment and supplies. I'm going to use the 6 rights of medication to make sure that I have the right IV solution, and if it had a additive, I would make sure that it was the prescribed additive. So now I'm going to calculate the drops per minute that I'll need for the infusion that I'll be giving. So we're going to be giving 1,200 milliliters of normal saline to be infused in 6 hours, and the infusion set is calibrated for a drop factor of 15 drops per milliliter. So I'm going to take 6 and multiply that by 60, you get 360. So I'm going to take 1,200 milliliters, divide that by 360, and then multiply that by 15, and that will give you 50 drops per minute. So now I'm going to go in my patient's room, and before I go, I'm just going to make sure that I look over infection control guidelines and standard precautions. I'm going to perform hand hygiene, and then I'm going to go into my patient's room.
Come in.
Hey, Miss Kelly, my name is Emily. I'm going to be your nurse for today. I'm going to come in and start some IV therapy for you, so I'll be in here for about 10 or 15 minutes. Is that okay?
Yes.
Okay, and is it okay if I touch you?
Mm-hmm.
Okay. Can you tell me your first name, last name, and date of birth?
Jalen Kelly, 9/25/96.
Okay, and do you have any allergies?
No.
Okay, great. So now I would grab my pump, if I had one, and attach it to the pole and make sure that I plug in the pump to the nearest outlet. And then I'm going to go ahead and prepare the primary infusion set. So I'm going to open my primary bag of saline. And I'm going to use 6 rights of medication just to make sure that everything is correct, and check the expiration date on the saline and make sure that there's no particles or anything, no discoloration or anything on it. And then I would get some tape and put a time tape on there, just my initials and the infusion rate and the time that I began. And then when it was done, I would make sure to put the time that the infusion ended. And I'm going to go ahead and open up my primary infusion set, or tubing. Really have to peel it. Doesn't want to come off. Okay, there we go. Okay. So now I'm just going to take off this little paper piece. And I'm going to make sure that both of these are out. So now I am going to make sure that the roller clamp is clamped, because we don't want any of the solution coming out before we get done priming. And so now I am going to take my bag and open this little guy right here. Is it this one? Okay, and then I'm going to take the top off of this and go ahead and spike. And trying to keep my hand as close to the hub as possible. And then I'm going to turn it upside down, and it's going into the chamber, but it's clamped all the way, so it's not going to go as far as it should. I'll have to pump it out just like that. So I'm going to go ahead and hang this with my little makeshift IV pole. Okay, great. So now we're going to get our tubing, and we're going to go ahead and prime the tubing before we attach it to our patient's IV. So I'm just going to let it run inside of the saline bag so it doesn't get all over the floor. So I'm just going to take this little, loosen it just a little bit because it'll still flow. We're going to put it in here, and I'm going to release the clamp, and it will start to come through, and it's dripping out in the bag, if you can see. So I'm going to clamp the tubing again. So now it's ready, and we'll take it out. And so now I'm going to perform hand hygiene, wash my hands again. I'm going to put on gloves. And then I'm going to grab an alcohol swab and make sure to wipe off just like that. Make sure that it is, and just make sure that it's clean. And then I'm going to grab a flush and go ahead and connect the flush just to make sure that the line is still secure, and I don't see any air bubbles or anything like that, so that's great. Very good. And I'm also checking for redness or anything like that, just to make sure that it's not swelling. Her arm isn't swelling or anything like that. And the patency of the IV is verified, so now I'm going to connect the IV tubing and make sure that the lure lock has been threaded correctly. And then we are going to go ahead and unclamp our tubing and just go ahead and let the solution run through. Very good. So now I'm going to check my 50 drops per minute. Just make sure that I have it set. So I have my second hand watch here. So I'm going to just kind of lightly unclamp the tubing, and we're just going to count. So now I'm just going to insert the tubing into the pump and just make sure that it's in there correctly. I'm going to set the rate of infusion at the correct amount for whatever was prescribed. And then I'm going to make sure to come back and check the tubing and the pump hourly to make sure that the correct amount has been infusing. And then at the end of shift, I would clear the volume that has been infused from the pump and make sure that I chart the volume infused in the INO chart. So now I'm going to come in and put in a secondary IV infusion. This could be an antibiotic or even sometimes Zofran, any kind of secondary medication. So I'm just going to use the 6 rights of medication administration and check that the solution is the proper solution. And if it had an additive, I would make sure that the additive is correct. And then I'm going to check the expiration date on the solution, make sure that it's good, and check and make sure that there's no particles or discoloration in this secondary solution. So now I'm going to open up the secondary tubing set. If it'll open. There it goes. Okay. And the first thing I'm going to do is grab this little thing right here, and we're going to undo this. And we're going to take our primary infusion set and hook this on like that. And then we're going to hook this onto our IV pole. Okay, just like that. And that allows for the primary infusion to infuse at the same rate it has been, and for the secondary infusion to correctly be primed into the primary infusion tubing. So now I'm going to prime my secondary tubing. Okay, and I'm going to label the tubing the same way I labeled the primary tubing, with the date and time, and make sure that the clamp is closed. We don't want anything coming through before we've got it primed. And then I'm going to peel off this and then take off my spike cover, and we're going to go ahead and spike it. Okay, very good. Turn it upside down, nothing is coming out. So now I'm going to put this on our IV pole. Just gonna go backwards. There we go. Okay, like so. And then what I'm gonna do is I'm gonna take this off and go ahead and compress the drip chamber and make sure that it fills at least halfway. Can you see it?
Mm-hmm.
And then I am going to prime the tubing by opening the roller clamp. We're just going to do like this. And allow the tubing to flow. There it goes. Sorry about that. And there's no air in the tubing or anything like that. It looks great, and the fluid is flowing correctly through the tubing. So I'm just going to take an alcohol pad and thoroughly clean the primary tubing. Very good. And go ahead and clamp the primary tubing, make sure that it's stopped. And then I'm going to attach the secondary tubing, just like that. Make sure that everything's good. And then I have both my clamps. So now I have programmed the pump to have the correct infusion rate for the secondary tubing and made sure that everything was good with that. The primary tubing is lower than the secondary tubing, and I have already checked with the 6 rights of medication administration to ensure that the correct medications are hanging and the correct patient is receiving the medications. So now I'm just going to unclamp both of these and allow the infusion to start with secondary and primary infusions going. And I'm going to also check the pump hourly. I'm going to stop these, but I'm going to check the pump hourly just to make sure that the secondary infusion is going correctly, the correct rate, and that the volume is being correctly infused. And make sure that the pump is showing the correct volume infusing, and make sure that all the alarms are on and audible. And then at the end of the shift, I would also clear the pump of the volume infused for the secondary infusion and make sure that I record the volume infused in the I&O chart. And at the end, I would go to the nurse's station and chart date and time, my name, the site and location of the patient's IV, and the type of the catheter. And I'll make sure to chart the solution, what I gave, primary and secondary, and make sure that I state that the patient tolerated it well and any teaching that I would have given the patient.